So good morning. Over the last 7 days, Iowa has seen an increase of more than 22,000 new COVID-19 cases and an average statewide positivity rate of 17.5%. This is a decrease from the 7 days prior when new cases totaled 36,000, and the average positivity rate was 28%. At a county level, we're seeing that positivity rates are beginning to stabilize in many areas, and these are welcome signs. And while we may be cautiously optimistic, we have a whole lot of work to do to bring the numbers down to a level where we can safely manage the virus while getting life back to normal. Hospitalizations remain high across the state, but yesterday was the first day in weeks where we saw a slight decrease in the overall number of Iowans hospitalized. So this gives us hope as well, but one day is far, far, far from a downward trend. Over the next week, it will be critical that we see hospitalization rates begin to stabilize. Every day, we are monitoring it closely and working directly with hospitals and healthcare systems to understand their situations and assist as needed. The vast majority of those hospitalized continue to be older Iowans. Currently, 74% of all hospital patients with COVID-19 are age 60 and older, which again underscores the importance of taking measures to protect those that are most at risk, whether due to age or underlying health conditions. As we approach the holiday season and even small gatherings occur among family members, we just need to be mindful of how our behaviors could impact others. Give you an update today on long-term care facility outbreaks. Later today, an additional 20 long-term care facility outbreaks will be reported. And just as a reminder, a facility moves to outbreak status when 3 residents in the facility test positive for the virus. That will bring the total number of active long-term care outbreaks at this time to 114, and I think we have somewhere around 443 long-term care facilities. This afternoon, we also will do an update to the long-term care dashboard on coronavirus.iowa.gov, and it will report the number of new cases. The additional information will report the number of new cases over the past 14 days in facilities with active outbreaks. News of long-term care outbreaks is, very concerning as it impacts our most vulnerable population. And as we saw earlier this year, the consequences of COVID-19 in these facilities can be devastating for residents and their families. The Department of Public Health and members of my team are also in regular communication with the long-term care associations and partners on how best to help facilitate during these challenging times. We're ensuring that that adequate infection control measures are in place. To make sure that they are in place is critical to preventing the virus from entering a facility or stopping its spread after an exposure. Training is available on infection control, appropriate PPE use, and emergency planning. And in an effort to more effectively assist long-term care facilities with staffing concerns, the state has provided updated guidance on preparation and implementation of emergency staffing plans. The State Hygienic Lab continues to support our long-term care facilities with testing needs, including when an outbreak occurs. So in addition, the lab is also providing Bionex Now antigen test cards to support routine surveillance testing, and more than 240,000 cards have been distributed to facilities across the state for this purpose. I'm also announcing today that $14 million of CARES funding will be allocated to Iowa's long-term care facilities to assist with the increased cost related to testing and staffing. Like our hospitals, it's important that we also provide assistance to long-term care facilities at this time, and that every Iowan continues to do their part to protect the most vulnerable of our healthcare workforce. Also, as positive cases have increased, so has the caseload for investigations conducted by public health departments, whether at the state level or locally. The volume of cases at this time requires additional resources, and as we announced earlier this week, we are working to increase our case investigation resources.